So how are you feeling about transferring the boy embryo? Hey, what's up? My name is Sarah, and I talk about depression and chronic pain because I was in a car accident and I just want to help other people because those are a few things that I'm going through. So in this video, we are going to be talking about our miscarriage and what we've been going through. It's going to be a Q&A. So we're really excited. There's some questions that I came up with for Jen and for myself to answer. Before we get started, make sure to subscribe down below. All right, let's get going. All right, so my first question. So what may be the cause of the miscarriage? And so, I want to talk about this because we did the PGS testing and, there was nothing wrong with that. Mm-hmm. And so, what do you think? Testing. Yeah, what do you think? I know that your prolactin levels were too high and you can talk about that.
My prolactin levels were 47 and what were they? 49, and at max they're supposed to be 27. Mm-hmm. So my prolactin levels were a little elevated. They said it was not enough to need medicine the first time, but now since we had a miscarriage and they don't know the reason, we had a genetically perfect embryo. Yeah. Now they're putting me on a tiny bit of medication to make my prolactin level normal.
So it could be that. It could be, so once we fix that, maybe, the next one will be fine. We don't really know. It's just a bunch of science. Maybe it wasn't meant to be. That one wasn't meant to be ours. Mm-hmm.
Yeah, it's been a lot of grieving.
I know, she's been sad. Mm-hmm. You look so cute.
Yeah, we don't have exact reasons.
Right. It's been difficult.
What the cause is.
Our second question. So what questions should you ask your primary care provider after a miscarriage?
Well, first of all, we asked why it happened.
Of course.
Yeah.
Right.
We also asked how can we get ready to try again? Mm-hmm. Because there's no sense in prolonging things.
Yeah, and dwelling on something that didn't work. Like we're just really optimistic, and we know eventually it's gonna work out. And you have to go through those failures, and that's just part of life. Yeah. So that goes with anything that you want to do that's hard. This is hard. Anything that's hard is gonna be worth it. And that was one of the questions I asked was, when can we do the transfer? Because we do have the boy embryo.
We do. We have a male embryo.
We do. We have a male embryo, so we're really excited about that. So before we talk about that, because there's going to be a question on that, just so you know. So are you done with that question? Do you have any more questions?
What questions did we ask the primary provider? Well, I asked her, what are my options for, a DNC or taking a misoprostol?
Yeah.
So you can take a pill that helps just let everything come out on its own. A lot of cramping, a lot of pain, and you have large bleeding for days.
And clots.
And then sometimes it doesn't even all come out, so then you have to go ahead and do the D and C again, which is disseminate and cautery.
Cautery, yeah.
Cauterate.
I don't know.
So I went ahead and did that. I just wanted to do the procedure, just the D and C, instead of taking the misoprostol Cytotec pill, because I didn't want to have to deal with all of the blood that comes along with it and the pain. It sounds traumatic.
Yeah, and there is a video on the DNC, so make sure to check that out. I'll definitely put a link down below for that. If you're interested.
So we just asked our options and chose the DNC. Those were the questions that we asked.
Yeah.
Kind of why it happened and what we can do to pursue forward.
Yeah. Third question. So what are our next steps?
You want to answer that one?
Yeah, it's exciting because we do have the boy embryo, and so our next step is for Jenna to take that prolactin medication. It's really tiny amount, and see how her prolactin levels are in the next few weeks, right? How long?
They're going to retest them in 4 weeks.
4 weeks
when I started,
and then from there we will figure out for a date for they have to do the HCG levels, make sure that's below 5. From there we'll find a date for our transfer.
Yeah.
So we're excited about that. You just have to keep the hope. This is hard for anybody who's gone through it. There's many of you out there, and I'm sure if you're watching this video, you've gone through it and you are, excited for us too. All right, so our fourth question. What are some things to expect and do after a DNC? Whoa. So for this question, the thing is that we have another video on the DNC, like the procedure and what Jenna went through, but you can go through it pretty briefly here.
What do you expect? after a DNC, you just have light bleeding for 2 weeks approximately. You have some spotting, some light bleeding, and you just let them know if you have any like fever or weird discharge. You just look for, any signs of infection.
And emotional. It's emotional too.
It is emotional. I feel like it's a lot of personal growth. You're expecting something and you just have to realign your thoughts with what's actually happening.
Exactly.
Yeah, after a DNC, you just are maybe a little bit of renewal. It feels good to know that you're moving forward.
Yeah.
What's that little pup doing?
I know, she's getting big. Yeah. She's a little snort. Whoops. All right, so number 5. So, how has your partner been through this process? So I'm referring to me, like how have I been through this process? Obviously, I've been supportive. I don't blame Jenna at all. She did everything, from taking the vitamins to eating right to not drinking coffee, no alcohol, no smoking. Obviously, she doesn't even do that anyways, but there's a bunch of things she was already naturally like doing and preparing, and also the folate, like even like months before. I'm saying 3-4 months before we even prepared. And then we did the genetic testing. So, we did a lot, and so we thought it was a for sure thing, like 99%. So it was very disappointing, this situation, and of course, I was sad. I cried about it, many times, but
girl,
I've been okay. We're doing okay, and we know that there's a lot of good things that are going to happen in the future. You just got to keep your head up, You just have to prepare yourself for anything. It's called life. All right, so let's go to the next question. So number 6, can we do anything to lower the risk of, miscarriage in the future? I just want to say Jenna can do all that she did before, like the vitamins and the folic acid and all that, or the folate. Is it the folate?
it's the same.
It's the same, okay. I don't know. I'm just like, too many names for things. So yeah, she can just take the folate and, do everything she can, eat well and do all those things, and me just being a support. And I don't know, is there anything you would do differently? I feel like I wouldn't. We did everything on point.
Well, when I talked to Dr. Amato through my chart, you write emails to your provider. She said that we could try steroids. So we're gonna try a steroid probably a little before and after the transfer of the embryo. So I'm gonna be on that. We're taking the progesterone shots and we're taking estrogen. I'm also gonna start taking an 81 milligram aspirin, lowers the chance of blood clotting. And we're doing the carbagline.
What is that?
I'm not sure how to pronounce it. It's a prolactin lowering medication.
Oh, that, okay.
Yeah.
I'm like,
it's
what?
the medication that lowers the prolactin levels.
Excuse me.
And I'm going to do everything I was doing before. I'm taking medications 3 different times into the day that were vitamins. Like the certain vitamins are better to take in the morning before you eat anything, and then other medications you want to take before you eat food. And then there's a couple medications that you take twice a day anyway, so you have to take it after food the first time and then after food the second time. And they're just normal medications that are recommended for prenatal stuff. So all of those things are what we're going to do to try to lower the risk of miscarriage in the future.
It's a good thing to kind of try something a little different, like add something than we did before, because then, if you do the same thing, you're going to get the same result, most likely. So it just goes with anything, with life. So it's like, you got to switch it up. But I think that's great. I'm glad that I know I saw the message actually. It was really long and I was like, whoa, Jenna wrote all this to the doctor. Yikes. She did a lot of research and stuff. So that's awesome. It's cool. So last but not least, number 7. So how are you feeling about transferring the boy embryo?
So at first it was a lot to take in because we had planned and hoped for a girl first. To now that I'm thinking about it, it's created a lot of personal growth, and I know that all of our embryos are going to be born, or we're going to try to use them at some point, if we have 10, we'll probably still try to use all of them eventually. And I'm excited to have our son. Like, you know, he's gonna be part of our lives no matter when. And so first is fine. Like, we're excited, and it's maybe the way that God intended it. You know, God always plays a hand in, you know, what we're doing. Like, he's the one providing the people with the science and the knowledge and, you know, the curiosity to create this, you know, ability for us to take her eggs and make embryos and put them into my uterus. And so it's part of God's choice to, you know, have us have this boy embryo available to us. So, you know, it helped me in a way to create some personal growth, and I'm excited to have our son first.
Yeah, he's gonna be cute.
Yeah.
What do you think,
It's gonna be a baby Sarah.
Yeah, it's gonna be cute.
It's gonna be a tiny baby Sarah.
Yeah, I'm so excited about the boy. I know that we didn't expect to have a boy first, you know, if this one works out. And, you know, we're hoping for a girl first because that was our plan. But I mean, you never know, you know, some things are just meant to be the other way. And it's going to work out either way. You know, having a boy as the oldest, you know, when this works out, it's going to be awesome because he's going to like
be independent.
Yeah.
He won't have anyone to take care of him
and
initially.
he's going to be taking care of the kids too. He's going to help us.
We'll be taking care of him. But
Well,
he won't be like,
we will.
He won't be
leave him
like
alone.
coddled by an older sister. He won't be like, you know,
Or older brother.
he won't be the younger one. He's
He'll
going to be the oldest
responsible
child. It's a cool role to play.
Yeah, it'll be cool. I'm excited.
Yeah.
It's exciting. Hey, I hope you found this video valuable. You know, it's hard to go through, you know, tough things, right? That's why I record, and we want to show you that, you know, anything's possible. You can get through it. This can really cause depression and anxiety. I know it's made me feel really sad and stuff, and I'm sure you've been really depressed too, but
We've been grieving.
yeah, but everything's gonna be fine. Anyways, make sure to subscribe down below. Also, be sure to hit that thumbs up. Also, don't forget to check out my socials. You know, this way we can stay connected. You know, if you've gone through a miscarriage or you know somebody, make sure to message me, contact me, it's okay. But hey, I'll see you in the next video. Peace.
You have to be your biggest fan. And when things are really tough and they're really rough and nothing's working, but there's something inside of you that says, I just have to follow that. Because you don't know who you're going to meet, who you're going to meet, who you're going to meet.